Ever wondered how local anesthetics work? How they numb a specific area of the body, allowing procedures to be carried out without causing pain? Well, you're not alone. Local anesthetics have intrigued scientists and medical professionals for centuries. These miracle drugs, in essence, block the nerves in a specific area from sending pain signals to the brain. They come in two main forms: injectable and surface anesthetics. Injectable anesthetics are used for more invasive procedures, where deeper layers of tissue need to be numbed. On the other hand, surface anesthetics are typically applied to the skin or mucous membranes for minor procedures, or to reduce localized pain or discomfort. From a simple dental procedure to a complex surgical operation, local anesthetics play an integral role in providing a pain-free experience. Local anesthetics have a rich history and have revolutionized the field of medicine. Let's delve into their past. Scene script. Local anesthetics have been in use for centuries, but do you know how they've evolved over time? The journey of local anesthetics is an intriguing one, tracing back to the very roots of civilization. Ancient societies like the Incas knew of the numbing properties of coca leaves, but it wasn't until the mid-19th century that we began to understand the potential of these substances. In 1855, a young chemist, Friedrich Geidke, isolated a compound from coca leaves and named it erythroxyline, which we now know as cocaine. This was the first local anesthetic ever discovered. It was revolutionary. However, the euphoria and potential addiction that followed its use led to a quest for safer alternatives. Enter Alfred Einhorn. In 1905, this German chemist synthesized procaine, also known as Novocaine. It was less potent than cocaine but also less addictive, making it a safer choice for medical procedures. Novocaine was widely used for dental procedures for much of the 20th century, until lidocaine, a faster and longer-lasting anesthetic, took its place in the 1940s. The mid-20th century was a golden age for local anesthetics. Bupivacaine was introduced in the 1960s. It was unique in that it provided a longer duration of action, making it ideal for post-operative pain management. In the late 20th century, the focus shifted towards improving the safety profile of these drugs. Ropivacaine, developed in the 1990s, was less cardiotoxic than its predecessors, and levobupivacaine, introduced in the early 21st century, demonstrated fewer neurological side effects. These milestones in the history of local anesthetics have not only provided us with a better understanding of pain management, but also showcased the persistent human endeavor to improve and refine the tools at our disposal. From rudimentary beginnings, local anesthetics have come a long way. But how do they work exactly? Stay tuned to find out. Local anesthetics perform a seemingly magical task of numbing pain, but it's not magic, it's science. Let's explore. Local anesthetics are drugs that block the transmission of nerve impulses in the area where they are applied. This results in a loss of sensation, including pain, in that area. They work by inhibiting sodium influx through sodium-specific ion channels in the neuronal cell membrane, primarily in their activated state. This stops the transient change in the electrical membrane potential, known as an action potential, from occurring. No action potential, no transmission of pain signals to the brain. Now there are two main types of local anesthetics: injectable and surface anesthetics. Injectable anesthetics are usually used for procedures requiring a deeper or more extensive area of numbness. These are directly injected into the tissue or near nerves to numb a larger area. They are commonly used in dental procedures or during minor surgical procedures. On the other hand, surface anesthetics are applied topically to the skin or mucous membranes. These are used to numb the surface of a body part for minor procedures like a skin biopsy or cannula insertion. They can also be used to numb the throat or airway before certain procedures. The difference between the two lies not only in their method of application, but also in their molecular structure. Although both types have a similar structure, surface anesthetics are usually more lipophilic. This means they have a greater affinity for lipid-rich environments such as the skin, which allows them to penetrate the skin more easily. Remember, the goal of local anesthetics is to prevent discomfort while allowing the patient to remain conscious and cooperative. They achieve this by blocking the conduction of pain signals in the nerves without causing a significant effect on other types of nerve fibers, like those responsible for touch or temperature. So now we know how they work. But when and how are they used in the medical field? Local anesthetics are a vital tool in the medical world. They're used in a variety of procedures, from dental work to surgical procedures. These miracle workers of medicine have transformed the way we manage pain, and today, we're going to delve into their clinical uses. Let's start with dentistry, one of the most common uses of local anesthetics. Whether it's for a routine filling or a complex root canal, local anesthetics numb the area, allowing dentists to work without causing discomfort. But the use of local anesthetics isn't just limited to the oral cavity. They're also extensively used in ophthalmology for procedures like cataract surgery. By numbing the eye, surgeons can perform intricate operations with patients feeling minimal, if any, discomfort. In the realm of dermatology, local anesthetics are used for minor procedures such as mole removals, biopsies, or even more complex procedures like skin grafts. They've made it possible for these procedures to be performed in outpatient settings, increasing patient comfort and convenience. Furthermore, local anesthetics play a crucial role in obstetrics. Epidurals, a type of local anesthetic, are often used to manage labor pains, making childbirth a less daunting experience for many women. In the operating room, local anesthetics are used in regional anesthesia for surgeries. This can involve numbing a larger region of the body, such as an entire limb for orthopedic surgeries, or the lower half of the body for abdominal and pelvic surgeries. This allows patients to be awake during surgery, reducing the risks associated with general anesthesia. Even in the world of sports medicine, local anesthetics are used for pain management and to facilitate physical therapy sessions. They help athletes recover faster, enabling them to get back in the game. So, as we can see, local anesthetics have a wide range of clinical uses, making them invaluable in various fields of medicine. Their role in pain management and improving patient comfort during procedures cannot be overstated. We've seen where they're used, but how are these anesthetics administered? Administering local anesthetics is an art and science combined. Let's understand how it's done. The method of administering local anesthetics can vary depending on the procedure and the area being numbed. There are several techniques, each with its unique considerations and potential complications. So let's dive into some of these methods. First, we have topical administration. This is the simplest method where the anesthetic is applied directly to the skin or mucous membranes. It's mostly used for minor procedures like skin biopsies or laceration repairs. While it's easy to use, it only numbs the surface layers, so it's not suitable for procedures that require deeper anesthesia. Next up is infiltration anesthesia. This is where the anesthetic is injected directly into the tissue that needs to be numbed. It's often used for minor surgical procedures like mole removal or dental work. The advantage is that it provides a deeper level of numbness than topical anesthesia, but it can cause temporary discomfort during the injection. Then we have nerve block anesthesia. This technique involves injecting the anesthetic near a specific nerve or group of nerves to numb a larger area of the body. It's often used for procedures on the hands, feet, or face. This method requires a higher level of skill as the healthcare professional needs to know the exact location of the nerves. Finally, let's talk about spinal and epidural anesthesia. These are used for major surgeries in the lower body like cesarean sections or hip replacements. The anesthetic is injected into the spinal canal or epidural space, blocking nerve signals from the lower body. This method requires a high level of expertise and has a greater risk of complications, but it allows for longer procedures without the need for general anesthesia. So, we've explored the fascinating world of local anesthetics, their history, how they work, their uses, and administration methods. Local anesthetics, a critical component in the world of medicine, making countless procedures possible and bearable. From their humble origins to the complex pharmacology that makes them work, local anesthetics have truly revolutionized healthcare. We've delved into how they numb our senses, blocking nerve signals to create a temporary loss of sensation, and explored their myriad of clinical uses. Whether it's a simple dental procedure or a complex surgical intervention, these agents play a pivotal role. We've also navigated the various techniques of administration, from topical to injectable forms, each tailored to specific needs and procedures. It's a testament to the versatility and importance of local anesthetics in medicine. They've made what was once unthinkable a reality. They've transformed pain management, making a world of difference in patient comfort. And that's a wrap on local anesthetics. Subscribe for more because you won't find me later. Stay curious, stay informed.